Attention tinnitus sufferers, you're about to discover the ultimate biohacks and treatment for tinnitus on YouTube. Are you tired of that persistent ringing in your ears? Are you searching for effective solutions to alleviate your symptoms? Stay tuned as we unveil some of the most powerful alternative treatments that may offer you relief. Tinnitus is when your ears ring or make other sounds. This can happen in one or both ears. When you have tinnitus, the inner noise you hear isn't caused by an outside sound. It's all internal. About 15% to 20% of people have it, and older adults are especially likely to have it. Tinnitus is usually caused by hearing loss from getting older, an ear injury, or a problem with the circulatory system. Tinnitus gets better for many people when the underlying cause is treated or when they get other treatments that reduce or cover up the noise, making it less noticeable. It can also be caused by other factors, including exposure to loud noises, certain medications, head injuries, and even stress. So now that you know what tinnitus is and some of the possible causes, let's get started with our treatment review. Number 1, reduce the amount of inflammation in the body as a whole. It is recommended that you start with an anti-inflammatory diet, which usually means staying away from processed foods, sugars, and certain grains, and focusing on whole foods that are high in nutrients. The best approach to an anti-inflammation diet is to eat a diet rich in omega-3 fatty acids. That would be foods like fatty fish, which can be found in salmon, mackerel, and sardines. Omega-3 fatty acids can also be found in flax seeds, chia seeds, and walnuts. You will also need to eat foods high in antioxidants like berries, leafy greens, colorful peppers, and cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts. Additionally, choose fats that are good for you, like olive oil, avocados, nuts, and seeds. Be sure to say no to processed foods, refined sugars, trans fats, high glycemic foods, and high sodium foods. Also, use caffeine and alcohol in moderation. Some people find that caffeine and alcohol make their tinnitus worse. Try cutting down or stopping your use of these things to see if it makes a difference. One more thing, stay hydrated. Dehydration can make tinnitus worse for some people. Number 2, identify food triggers. Try to figure out what foods may be causing your tinnitus. You may want to think about getting a food sensitivity test to find out if there are any foods that may be making symptoms worse. The goal of these tests is to find out if a person has bad reactions to certain foods. There are several ways to test for food sensitivity, such as IgG antibody blood tests and elimination diets. On an elimination diet, you cut out foods that could cause problems for a certain amount of time and then slowly add them back in to see if you have any reactions. Number 3, Biofeedback and Neurofeedback treatments. These are non-invasive forms of therapy that teach people how to control certain functions of their bodies and brainwave activity. With biofeedback, sensors are used to measure things like heart rate, muscle tension, or skin temperature. These measurements are then shown to the person in real time, giving them information about how their body is responding. The goal is to make you more aware of these functions and teach you how to control them on purpose. This could help reduce the stress and tension that triggers tinnitus. With neurofeedback, people are taught on how to control their brainwave activity. Electroencephalogram, EEG sensors, are used to track the patterns of brainwaves. People can learn to self-regulate their brainwave activity through repeated training sessions, which could help alleviate tinnitus symptoms. Number 4, acupuncture for tinnitus. Acupuncture is a form of traditional Chinese medicine that involves putting thin needles into certain parts of the body. Acupuncture has been used to treat many health problems, including tinnitus. Some studies and personal stories suggest that acupuncture may help some people with tinnitus feel better or get temporary relief from their symptoms. We don't fully understand how acupuncture might help tinnitus, but it is thought that it might affect the central nervous system, help people relax, and improve blood flow. Number 5, chiropractic care for tinnitus. This approach is a type of alternative medicine that focuses on diagnosing and treating problems with the muscles, bones, and joints, mostly by adjusting the spine and other joints by hand. If your tinnitus is accompanied by musculoskeletal problems like neck or jaw pain, a chiropractor may be able to help with adjustments and treatments that are aimed at those problems. As you can see, there's a few ways to cancel out that never-ending concert in your head. With these next few options, you may finally say goodbye to the free symphony that's been following you around. Here's treatment option number 6, sound therapy. By adding outside sounds, this method tries to make tinnitus less noticeable or distract from it. White noise machines, fans, or sound generators made for that purpose can help. Some people feel better when they listen to soothing music or sounds from nature. Number 7, tinnitus retraining therapy, TRT. Sound therapy and counseling are used together in TRT to help people get used to the sound of tinnitus. It tries to change how the brain reacts to tinnitus, making it seem less important and causing less stress. Number 8, cognitive behavioral therapy, or CBT. helps people with tinnitus come up with ways to deal with their symptoms and change negative thought patterns. It focuses on dealing with the stress and emotional pain that come with tinnitus, which can help lessen the effect it has on daily life. Number 9. Tinnitus Maskers. Tinnitus Maskers are small electronic gadgets that make low-level sounds that can cover up or mask the sound of tinnitus. They are worn in or around the ear, and while being used, they give temporary relief. And finally, here's a few practical items that can be consolidated under treatment approach number 10. Avoiding loud noises, wearing ear protection when necessary, getting regular exercise, practicing stress-reducing techniques like meditation and yoga, and considering a hearing aid if you have hearing loss in addition to tinnitus. Hearing aids can help you hear better and may make the ringing sound less noticeable by boosting sounds from the outside world. Regarding medications, there isn't a specific medicine that is approved to cure tinnitus, but some medicines can help with the symptoms. For example, tricyclic antidepressants or anti-anxiety drugs can help people with tinnitus deal with anxiety or depression. Please remember, before trying any treatments for tinnitus or making big changes to your health routine, you should talk to a doctor, audiologist, or tinnitus specialist at the very least. They can give you advice that is specific to your situation, your medical history, and any underlying conditions you may have. Also, it's important to keep in mind that self-diagnosing or self-treating tinnitus without professional help might not lead to the best results. It can also delay getting the right care or hide health problems. Liking this video and subscribing helps get this valuable information in front of more people who may need it. Thank you for watching and sharing.